Hello, and welcome to this segment of EHR Institute's Intech Brief, where we bring you up-to-date news that affects today's EHR professionals. I'm Jeffrey Erb, your host for the show. The government has released the names of 15 communities across the country from Maine to Hawaii that will serve as models for the broad use of healthcare information technology under a $220 million program aimed at improving care and efficiency and creating new jobs. Vice President Joe Biden and Health and Human Services Secretary Kathleen Sebelius announced the names Tuesday. The funds for the program are part of the American Recovery and Reinvestment Act and are being dispersed through the Office of National Coordinator for Health Information Technology. The ONC received 130 applications for the program. Biden said that these pioneering communities are going to lead the way in bringing smarter, lower-cost health care to all Americans through the use of electronic health records. He went on to say that because of their early efforts, doctors across the country will one day be able to coordinate patient care with a stroke of a key or pull up life-saving health information instantly in an emergency. And, for the residents of these communities, that future is about to become a reality. They've dubbed the term Beacon Communities, and they will use health IT resources within their community as a foundation for bringing doctors, hospitals, community health programs, federal programs, and patients together to design new ways of improving quality and efficiency to benefit patients and taxpayers. Each Beacon community has elected specific and measurable improvement goals in each of three vital areas for health systems improvement: quality, cost, efficiency, and population health. The goals vary according to the needs and priorities of each community. The 15 Beacon communities include Community Services Council of Tulsa, Oklahoma; Delta Health Alliance in Stoneville, Mississippi; Eastern Maine Healthcare Systems in Brewer, Maine; Geisinger Clinic in Danville, PA; Health Insight in Salt Lake City, Utah; Indiana Health Information Exchange in Indianapolis, Indiana; Inland Northwest Health Services in Spokane, Washington; the Mayo Clinic of Rochester in Rochester, Minnesota; Rhode Island Quality Institute in Providence, Rhode Island; Rocky Mountain Health Maintenance Organization in Grand Junction, Colorado; Southern Piedmont Community Care Plan in Concord, North Carolina; the Regents of the University of California in San Diego, California; the University of Hawaii at Hilo, Hawaii; and Western New York Clinical Information Exchange in Buffalo, New York. As part of its second annual Outlook on Healthcare Economics and Innovation, the Silos Group, a healthcare venture capital firm, has spotlighted information and medical technology as critical to healthcare reform, insisting that expanded adoption and investment activity in IT will produce big results. The firm notes that failure to establish a culture of innovation in healthcare delivery will lead an existing $2.5 trillion industry to continue to inflate to over $4.5 trillion by 2019, as projected by the Centers for Medicaid and Medicare Services. They go on to say that a real healthcare industry revolution would go a long way towards eliminating the 30% waste and error in our current system, improving national competitiveness, and creating new products for global exportation. 6 areas for high-impact, high-return changes include an efficient system to prevent and manage chronic illness, which accounts for 78% of all our healthcare expenses; error reduction in inpatient, ambulatory, and post-acute care; new technology and benefit plans to deal with the diabetes epidemic, which costs an estimated $170 billion annually in the United States; new medical technology to enable earlier, better diagnosis and thus earlier intervention with high-cost, high-morbidity diseases; medical devices to foster less invasive and more effective surgical interventions; and expanded adoption and investment activity in healthcare information technology. This includes venture investments to recognize and sponsor entrepreneurs committed to developing modern solutions that bring about much-needed innovations to put the U.S. healthcare economy on track for a successful future. Also in the news, 51 healthcare groups have called for changes of the federal EHR adoption proposal. A coalition of 51 healthcare providers told Health and Human Services Secretary Kathleen Sebelius that they needed additional time and greater flexibility to meet the criteria of the Centers for Medicaid and Medicare Services proposed electronic health record rule published earlier this year. They wrote that while they fully support the purpose of the American Recovery and Reinvestment Act of 2009 to encourage the adoption and use of EHRs, they are asking that it be done in a manner that will remove barriers to and promote the widespread adoption of healthcare information technology. The groups signing the letter included the American Hospital Association, the American Medical Association, the American Academy of Family Physicians, the American College of Physicians, the American Psychiatric Association, the Association of American Medical Colleges, and the Medical Group Management Association. They say that the proposed rule currently takes an all-or-nothing approach, where failure to meet any one of the requirements means the provider will not receive an incentive payment, and that this approach fails to acknowledge that providers have made enormous progress in creating and maintaining EHRs to improve patient care and safety. They added that these requirements are asking for too much too soon. Specifically, the healthcare organizations say that the requirements include advanced functions such as computerized provider order entry, clinical decision support, and electronic medication reconciliation, which generally occur at the end of a multi-year transition to EHRs. According to the letter, the proposed phase-in period for this aggressive set of requirements is unrealistic, and it fails to acknowledge that providers adopt EHR functions incrementally and are in different places in their adoption process. The Coalition's letter parallels many concerns expressed by both House and Senate members in letters sent in March to the acting CMS administrator. Like Congress, the groups are asking to extend the transition to meaningful use to 2017, consistent with the stimulus legislation. And finally in the news, a recent study by Florida-based Volte finds that smartphones save money and stave off staffing shortages. Researchers have found that ineffective communication wastes as much as $12 billion nationwide each year, and that frustrations with outmoded systems can lead to nurse dissatisfaction and, ultimately, exacerbate the hospital staffing shortage. However, the study finds that smartphones offer a solution to many of today's healthcare communication issues. With PC-like functionality and advanced capabilities, smartphones provide a single interface to make calls, send texts, manage schedules, organize tasks, view online literature, and receive alerts. Most clinicians are already familiar with smartphones, and the devices easily integrate with hospital networks, providing a solid platform for application developers. Mobile healthcare applications allow physicians and nurses easy access to medical information, bringing faster, more informed decision-making to the point of care. For a typical 500-bed acute care hospital, communication problems between physicians and nurses create an annual $4 million economic burden. The white paper reports, and often needlessly increases the length of hospital stays. Worse, poor communications can adversely impact care. Noisy overhead paging systems can cause nurses to miss calls, particularly when working within patients' rooms. In addition, most point-of-care staff are saddled with multiple devices. A nurse may carry a pager, PDA, and a mobile phone, with each device providing specific functionality and generating its own alarms. The nurse can't prioritize alarms according to criticality, so a pager buzzes the same tone when a patient wants ice or for a code blue alert. Well, that's all for this segment of EHR Institute's Intech Brief. Don't forget to visit us online and interact with your peers involved in EHR at www.ehrinstitute.org. Thank you very much.